Adrenaline is a life-saving drug and is covered under the Medicines Act for anyone to give in an emergency. If the patient is having a severe allergic reaction which involves airway, breathing or circulation, the adrenaline should be given intramuscularly into that patient. You should see the blue dot on the top of the ampoule, and below that is a weakened area in the neck. This has been filed away to make it easier to break open. In order to drop the fluid from the top down to the bottom, use a flick of the wrist, and it should now be all in the bottom of the ampoule, ready to drop as necessary. When breaking the ampoule open, sometimes it can shatter and it can cut your fingers. Therefore, use a tissue around the head when breaking open. And break away from the blue dot. Remember to dispose of sharps safely. Using a 1mm syringe and a green needle if possible, draw up the appropriate dose from the ampoule. For an adult, this will be 0.5 of a milliliter, which corresponds to 0.5 of a milligram. For a child between 6 and 12 will be 0.3, and for a child under 6 will be 0.15, or as close to that as you can get. Draw up nice and slowly the appropriate amount. It doesn't have to be exact, just as close to the point as you can. And as you can see there, we have drawn up 0.5 of a milliliter. It's essential that adrenaline is given intramuscularly, as it can cause harm if given intravenously. One of the best sites is the anterolateral middle third of the thigh. To identify the position, drawing an imaginary line up the anterior aspect of the thigh and drawing an imaginary line up the lateral aspect of the thigh. Between those two tram lines, identifying the knee and the hip, measure to the centre third between those tram lines. So this box is where we want to give the adrenaline. Going through the clothing, just stretch the clothing and push against the skin. We're going to go straight through and inserting approximately half of the needle into the thigh. Holding very carefully, we want to aspirate to make sure that no blood comes back. If blood comes back, discard the whole of the needle and syringe and start again. If nothing comes back, it's safe to inject. Carefully remove and dispose of your sharps safely.